All right, here's everything you need to know about getting nose filler. I'm a cosmetic nurse practitioner. I've been injecting Botox fillers for the past 11 years in Los Angeles. I'm gonna run you through this list and show you some photos. So with nose filler, you can enhance your nose without surgery. We can camouflage the bump on a nose, lift the tip of the nose, minimize asymmetries, create a highlight or a contoured look down the center. This can help the nose appear smaller. We can also do some shaping on the nostrils. All of this without surgery, without any downtime. We do this with hyaluronic acid filler. Hyaluronic acid is a sugar molecule. We have this in our bodies. It binds water. We make small injections with the needle along the nose to get your results. Remember, it can do all those things. It's super customizable to you and your goals. So I have some patients that want to make their nose completely straight, other patients that want to lift the tip, other people want to keep some of their bump, not have it all the way gone. You're going to look like yourself. You're going to look fresh. You're going to notice it. Not everyone's going to be like, who did a nose job on you? Plus, you'll be able to see the results right then and there. So this usually lasts about 1.5 to 2 years. I do it for my patients over 2 sessions. We spread those sessions like 6 to 8 weeks apart, so it has time to settle, and then we build on that initial foundation. When we're doing nose filler or filler anywhere in the face, what we want to be mindful of, safety-wise, is that we're not blocking off blood flow. We've got blood vessels all over our face, all over our body. We want to make sure we're not putting too much filler in any spot, that blood can't flow like normal. So what we're looking for is that your skin color is normal. You don't have any extreme pain. You don't have any vision issues. If you had any of these things, it could mean somehow we're blocking blood flow and we would need to dissolve the filler. Specifically for nose filler, the blood vessels run behind the eye. So we don't want to block blood flow off to the eye, or else there's rare risk for blindness. In the 11 years I've been doing cosmetic injections, I've never had to dissolve any patient, any part of their face, any filler for any of these rare emergencies. So again, super rare. We just want to be mindful of these rare complications and be able to intervene. For all my patients that fly in for their appointment, you have to stay in town for at least a day. So if there were one of these rare emergencies, we can intervene, we can dissolve it. Again, I've never had to do that for anyone. Just want to be super safe. Pre and post care, just know you can bruise, you can swell with this or any cosmetic injectable. So for that, make sure you don't have any major event, no photo shoot in case you're bruised or swollen. I don't want you showing up feeling self-conscious about that. Honestly, for the nose, it's pretty straightforward. I don't typically have patients having a ton of excessive bruising or swelling, but just be mindful of this as you're planning your appointment. Before you come in, avoid blood thinners unless medically necessary. Avoid alcohol, take arnica, eat pineapple. If you can do this 1 to 2 weeks before your appointment, you're amazing. But if you can only do it a few days before, you're still going to be better off than not doing it at all. During your appointment, we're going to get photos from all angles. We're going to discuss your goals. I'll let you know limitations we should be mindful of. I have a medical assistant in the room that's going to help tap your shoulder while we do your injection. I use a very tiny insulin needle, and that'll help me do the pokes. To help numb the area, we give you ice before and during the injections. There's also numbing mixed inside the filler already. And in general, patients say this area doesn't have a lot of pain. It does get a little more sensitive here at the tip and at the base of the nose, but it is very tolerable, and the injection process is pretty short, especially if you prep for your appointment by following the pre-care so you're not bleeding so much. To help with the bruising and swelling, you're going to want to ice for a few days after your injections. Don't have exposure to excessive heat like saunas and hot tubs. Try to avoid excessive exercise to help minimize that bruising and swelling. You're going to continue avoiding the blood thinners, the alcohol, taking the arnica, eating the pineapple after your appointment to help with that bruising and swelling. Don't apply any makeup that day. We don't want any infection in the pokes that we make. Also, don't put pressure on the areas we inject. So be mindful of glasses, goggles, mask, anything that can press on the areas we inject, we want to avoid. This hyaluronic acid filler gel, it's moldable for up to a month, but really it's the first few weeks it's the most malleable. So that's where I don't want you laying on it, pressing on it. Just be careful. And then remember, we do 2 appointments spread 6 to 8 weeks apart. When you come back for that second appointment, we're going to build on that initial foundation. Typically, when you come back for that second appointment, before we start it, it's not as lifted or as straight as the first time fresh off the needle. That is normal and to be expected. That's why we've built in that second session. Give me all the feedback from your previous appointment. Let me know what you liked. If you liked it when it was more lifted, or if you want to lift it more, make it more straight. Let me know your thoughts. Results are going to last around 1.5 to 2 years. You'll slowly noticing it not be as straight or as lifted during that time. And typically at that 1.5 to 2 year mark, it's not all the way back to normal as if we never did anything, but it doesn't have that same definition as when we did the initial sessions. And then just understand understand there are limitations with filler. You know, it's not going to pinch your nose in and make it super small, but it can create this highlight where things look smaller. But I always encourage my patients, if you're open to surgery, get a surgical consult so you're able to make an informed decision about what treatment you want, what is going to be best for you and your goals. Let me know what questions you have, and when you're ready for yours, come see us.